Broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, this is Quinn Mulholland with the National Housing Conference. Just wanted to let you all know that we will be getting started in just a few moments. We're going to wait for a couple more people to get on, but we'll be getting started within the next minute or so.
You can go.
Alrighty, so thank you to everyone for joining us today. We're sure that everyone is very busy right now. Today we're going to be discussing NHC's new COVID-19 Housing Resource Center, the launch of our new website, a few housekeeping matters to address before we jump in. Firstly, the video will be posted on our website after the call, so you'll be able to share that among your network as you wish, and also go back and rewatch it if you'd like. We're also going to keep everyone in listen-only mode for the entirety of the webcast, just to ensure that everyone can hear okay. But if you do have any questions during the webinar, we will be doing a Q&A session at the end. So everyone should see a question icon at the right side of your screen. So you can submit questions that way, and we will collect them to share with David to answer at the beginning of his presentation. So please, if you have any questions during the webinar, don't hesitate to ask them. That way you can always also email me at qmulholland@nhc.org, which you can see on your screen, and I will make sure to get those questions to David, and we will try to answer as many as possible. Otherwise, if you have any other comments or issues, you can use the chat function or send me an email. And with that, we are going to go ahead and get started. So I will send it over to David.
Thank you, Quinn. Welcome, everybody. And thank you so much for joining us. We are very excited to have everybody on the phone. And we know how hard you've been working, and we really are grateful for everything that you do, and helping you do your job is existential to our mission. We have developed this exciting site to help you focus on your priorities and have easy access to the information and resources that you need to serve your members, your stakeholders, and your constituents. It is your site, and so your feedback is going to be really critical to its continued value. We want to know what needs to be improved, new content that you have on your site or that you're using on other sites that you're not seeing here, and especially best practices as they're developed in dealing with so many of the novel challenges to this novel virus. I want to make a point of really recognizing an amazing team that put this together. I have to say, you know, there's that old saying that if you we can do the difficult immediately and the impossible takes a little longer. Well, we went to Electric Pulp, which is a small web development team in Sioux Falls, South Dakota, and asked them to develop this website from scratch. They did it in less than a month, And this kind of a project would normally take at least 2 to 3 months and often much longer. Allison Brua and Eric Canas are on the line today, and I just want to thank them for all the incredible work that they've done. Our leadership team here, Bob Simpson, who's consulting with us as our senior policy advisor, and Gina Mitrakis, who's also working with us as a senior policy advisor. They have done incredible work thinking through this project, making it possible. Amanda Mitchell has coordinated all of our logistics. The rest of our NHC staff, Quinn Mahone, who you all know, and Andrea Nesby, have put countless hours into this project. And soon we're going to be joined by 2 research assistants, Emily Selch from University of Chicago and Elena Ion from Harvard University, who are going to be the backbone of loading fresh content onto this site, keeping it up to date, and getting you everything that you need. And finally, you know, I have to give special thanks to our funders who made this whole initiative possible. Bank of America, JP Morgan Chase, and Wells Fargo have been longtime supporters of NHC. They stepped up, immediately got a hold of us at the very beginning of the crisis, said, you know, we want to convert all of your funds to general operating. You need to use your best judgment on how you're spending it to support a response to this crisis and helping your members, and let us know what you're doing, because they recognize we weren't going to be able to have a gala, weren't going to be able to have the kind of normal events that we have that they sponsor in the past, and they just came in right away, and that gave us the ability to say, okay, we're going to be able to add some resources here, and we're going to be able to sign up people for this to help us build this out and do the other things that we're doing. So with that, let's look at the site. I'm going to go over here to show my screen. Are we seeing it now?
Yep, see your screen.
And there we go. So this is the COVID-19 Housing Resource Center. And what we have here is the home page with the entry-level information that's updated on a regular basis. This is really kind of my favorite part of the page, because it really addresses the core mission of the page, which is to bring in resources from every facet of the housing industry, so you're never more than a click away from the information that you need. That means that we are culling all the latest information from dozens of sites and hundreds of web pages. We want to be able to give you the information that you need to search for, but also we want to be able to provide you with easy to understand updates of what's new to the site. So many of us have had to go on to, you know, dozens of sites a day if you're really going to keep up with everything that's going on. And so much of that information is overlapping. But the information that isn't overlapping is incredibly vital. And we just don't have the resources and the time and the staff to do all that research every single day. So it's inevitable we're going to miss stuff. And this is something that, as people were loading content onto their pages, became very quickly apparent to me. We've loaded 406 resources for this first version. You will continue to see every week, often every day, new resources being added to the page, new updates being made. And behind the scenes, we're also going to have our research team going through the sites that are older, making sure they're up to date, making sure that the link is fresh, and taking off information that is no longer up to date, or just annotating it and saying there's important information in here. Some of the facts have been overtaken by events. We want you to know what you're getting. And we also want to be able to have you go to the page and see it in real time. You can see here that these are the pages that were added in the last 23 hours. But if you go further down, you'll see there are pages that were added 2 days ago. These pages are older, and they get older as you go through all the pages. And you can see here as you go through, move through it, we're going to have additional information that is older. And once you've really explored the site, what you're going to find is that you can easily find out what's been added to the site on any given day. And so we'll just go back here and refresh the page. And I'll give you an example here. You can see that there's information from for homeowners, for multifamily financing, for property managers, for nonprofits. Here's a webinar that was run by Enterprise Community Partners. If I click on that, I'm going to go to a new link and a new tab, excuse me, and I'm going to go right to the site and come right into
Welcome everyone. Thank you
the
for joining
webinar.
us for today's webinar.
And it'll be in a new tab, and I can go back to my current search where I'm at right now. If I want to look and see what the CDC is doing on cleaning and disinfecting, I can go here. That'll be a new tab. It'll continue to open up additional tabs for me as I'm moving through the site. And this is so you're able to both navigate our site easily, but for instance, if your information is on the site and we're clicking onto your home page or your FAQ, we want the people who are on the site to be able to quickly navigate your page and then go to your home page and then find additional information on your page, so that we're really leveraging the work that you're doing. Or in the case of when you're looking at other people's sites, you're able to explore their page easily and then come back to what you were looking for originally. We have a filters option bar, which I'm going to come back to in a minute. At the end of these 16 boxes, you can see here we have 26 pages of these tiles, they're called, is the latest NHC COVID-19 webinar. This happens to be our webinar. We're going to be doing a webinar with Mark Calabria from FHFA on Thursday. We're going to be doing a webinar with the Deputy Secretary of HUD, Brian Montgomery, next week. But there are also other webinars that are coming up. There's several of them being held today, but we'll be adding other webinars to this page that also, to the webinars page, that also are worth looking at individually. You can see again here, opens up in a different tab, shows the event is past. You can click on the webinar and actually see the webinar here. I won't load that one. And then our frequently asked questions are linked here at the bottom as well, which I'm going to show you shortly. Let me go back up to the filters bar. And, you know, right now there's 400 resources. Within a very short time, we'll probably have over 1,000. Who knows how many we'll have in a month or two. This situation is going to be going on for some time. We have no idea how long. And as this continues, and as you all develop new resources and need the additional information from other resources, this could become very cumbersome very quickly. And it's fine that you know, you can see the latest information from 6 hours or 12 hours or 2 days ago, but if it's been a week since you've been on the site, you know, you could get pretty lost, and maybe you need information from before. So let's say that you're going through here, and we can sort by the subject matter, filter by subject matter. So first I'm going to look here and say, let's say I'm a homeless service provider. So you can see here on the right that there are 60 resources related to homeless service providers. But I can narrow that even further by resource type. You see this has come up now in the search bar. And I can identify the resource type and say, well, what I really am interested in is what the federal guidance here is. And now you'll see I've got 14 resources that are just on federal guidance. If I go back here, let's see here. If I go back and I go back to our homeless service providers page, let's say I'm actually in California and I want to know what's going on in California. And so here are the homeless service providers information for California. This is what we've entered right now. There obviously will be much more going on, but if I'm in California and I'm looking for what's going on for homeless service providers and I want to see everything, I can just go in here and include my federal resources. And now I've increased the amount of information that's here, and I can go back and see here's the California information and federal resources that are relevant to me. Another example would be if I'm going here through for multifamily financing, you can see I've got 79 resources on multifamily financing. I can go through here and identify individual areas, state and local, federal guidance. And then again, I can check out and see what's going on in California. And here's information on California. I might want to see what's going on in, say, the District of Columbia, or say we'll call it Maine or Maryland or Illinois. Here's in Illinois, no resources found. So I did that on purpose because I knew there wasn't anything there. We're adding resources there and we're continuing to fill in, but I wanted to make sure you can see that when you come on the site, you're going to see in some states we've got a lot of information and others you don't. If you're using the site in Illinois and you see that we haven't loaded Illinois sites yet, and you know there's places we need to be, then just send us a note and say, hey, here's 3 pages that I use frequently, or get a hold of me and I can tell you what are the great resources in Illinois. When you go on there a week from now and there are 10, and you know there are 10 new ones, we're going to have staff that are looking for those, but you don't have to wait for us. You can let us know, send us a note at COVID-19 staff at nhc.org. I'll mention that again, and we'll be able to add additional sites. It's a very collaborative site. It's intended to be that way. We also are going to have consumer-facing information, and this is information for homeowners from the National Consumer Law Center, and this is what consumers need to know about mortgage relief. This is such an important piece of information. Here's advice for consumers on mortgage relief from NCLC. You can see here it's a PDF file. It's come up in a different tab. I can go through here. There are links within the tab that I can then link on and see what Fannie Mae is saying for consumers. Come back here to the site, clear my filters, and I can search again. Same thing with that. I can go through individual states. I go here for, say, information for homeowners in Texas. Now I've got information specifically from Texas relevant to homeowners. So that's the navigation bar for the site and how you get through all of these growing number of tiles. But we also have frequently asked questions, and this is something we're just starting to build out now. For those of you who are beta testing, you know that this was under construction. Here you can see, if you look at, for instance, single-family mortgage industry, here are questions that are specific to single-family mortgages. Do the GSEs accept delivery of mortgages in forbearance? This is a great example here. The answer on this site is no. During the forbearance, the borrower is not making payments and the loan is not eligible for sale to Fannie Mae. As of this yesterday, that was accurate. Today, it's not accurate anymore. They just changed it. So now we're going to go in there, we're going to change it to yes, and you'll be able to go to the site and you'll be able to see, here's the source. This is the Fannie Mae information on selling that was updated on the 14th, but you will see that by tomorrow, we'll have the latest from today. And as you probably saw, that was announced earlier. And so we'll be able to see that. Again, here's a similar question. Can a servicer quickly offer a CARES Act forbearance to a borrower and comply with CFPB's loss mitigation rules? And the answer here is yes. You can, and this is the quote from the CFPB site. And if you want to go to their page, you can go right here and see more information on this issue. I expect this FAQ page is going to grow dramatically. I was looking at HUD's FAQ page for multifamily. It's 38 pages long. Some of that, you're going to need to actually go through all 38 pages. But in that 38 pages, there are a dozen questions that most of you are going to want to know answers to, and that you don't need the additional technical expertise that is buried in the rest of the page. And you can simply go here, look it up, get the answer you need to the specific question, not have to go through all 38 pages to find out the answer to your question is on page 14. You'll also be able to search using our search engine. And you can see here, let's say I want to search, and now I'm winging it, HUD and multifamily. And now I've come up with these search results for HUD and multifamily. Go to the next page here and return to my resources. And then I'm going to go back to the home page. So the last area that I want to mention is the best practices page, and this is still under construction. And I think this is really important. We had a few things we could put up. We wanted to wait till we had a broader selection. We're really looking for you to develop content here for us. We're going to be doing our own research, but as you come up with solutions to problems, let's say you're in a hot spot where the virus is really a problem, and in the building that you're managing, maybe it's a 40-unit building and 15 people have COVID-19, and some of them are your staff, and now you're in a situation where you've got to continue cleaning surfaces, but your cleaning staff either can't get in the building or are sick themselves. What do? How are we going to resolve that? Now, some people have suggested maybe you organize your tenants to help get volunteers to do this work. It's obviously in their interest. How did you do that? I think some of that occurred during Sandy, I heard. Somebody's going to come up with a protocol on doing that. They're going to write it up and start to share it. We want to make sure everybody has access to that. There are other best practices that are already been written up, and so we're going to be filling those into the site. And then as your organization comes up with new best practices, it's almost always going to be a problem that you realized there wasn't information on how to deal with it. You had to make something up. We want to hear about that. So it's going to go there. That's the overall background on the site. I think that it's very exciting for us. We hope it is for you. I just want to reinforce the importance again of giving us feedback on this. If you find something's difficult to navigate, let me know. If you find something is missing information or the missing is incorrect, send us a note. This is how it's going to stay up to date. I really want people to feel like you own this, and that and you should feel very comfortable providing feedback, especially around added resources. If you're putting new information on your site, you don't have to wait for us. You can just send us a note at COVID-19 staff@nhc.org and say, hey, we just put this up. Let me know when you post it, and we'd like to share it with people in the housing industry. So that's the basic overview. And with that, I'm going to turn it back to Quinn to manage some of the questions, and I'll be happy to answer them, or somebody from our team can.
Great. Thank you, David. So just as a reminder for those who may have joined late, the way that you can ask questions, should you have any, is by hitting that icon with the chat bubble and the question mark inside on the right-hand side of your screen, and typing in a question and sending it over. You can also always just email me at qmulholland@nhc.org. So one question that we have, David, is how frequently are the resources on the site updated?
So that's a great question. We're going to be updating at least weekly. Chances are it'll be more regularly, and sometimes it'll be daily. If we have a half a dozen things that have come in on Tuesday, we're not waiting for Monday to put them up. We'll get them up there on Wednesday. And so we'll be, as we build research staff, we'll be able to move content onto the site faster, but we'll be updating them at least once a week in the beginning.
Great. Another question is about the frequently asked questions portion. So person is wondering how to submit a question to be answered in that section to our staff.
So that's, again, a great question. I think that the easy way to do it is there are two. One is on the page you'll see here. I kind of zoomed through that pretty quickly. I don't mean to make people dizzy. But as you go through the bottom of the page, under the list of categories, these are the same categories we used in the filters. You can see here it says not finding the answer you're looking for, just ask a question. I'll click on that and you can fill this in, or you can send us a note at COVID-19 staff@nhc.org. I believe these are both going to go into the same mailbox eventually, but fill it in here, write your question, and then we'll take it on.
Great. And just to clarify, on that email address, it's COVID-19 with no dash staff@NHC. So that is the email that everyone can reach out to. Another question, David. Is there a way to search for resources from a specific organization on the site?
That's great. Yes, there is. So let's say I want to search here around the issue of homeless. And I can search like this, and here's the results for homeless. But let's say I'm looking for something from the National Multifamily Housing Council. Please tell me I'm getting this right. And here's information that features them or was issued by them. I want to know what's going on at Fannie Mae. I can do this. Here's my search results for Fannie Mae. So let's say I want to do Fannie Mae. Fannie Mae and multifamily. And then I'm going to get a search there. So with that, what's the next question?
Great. So we have someone wondering, is the site live right now, and are people able to share it with colleagues at this address, covid19.nhc.org?
It is. The site is live. Please feel free to share it. You can link to it on your page. We want this to be a back and forth relationship, so please feel free to do that. And if you have sections of this you want to use, come talk to us as well. We want to have as open a policy with our site as possible. The point of this is to make sure that you have all the resources that you need from the site. And as we add content, we want to make sure that you have access to the content you need for your outreach.
Great. One person is wondering whether the color of the resource tiles bears any significance.
No, it does not. We've mixed it up so that they're not all blue, but we have not. We do tag the information with a variety of tags to make it easier to search, but it's the colors don't have any particular relevance other than the fact that they're part of our logo.
Great. Another question, can organizations upload content directly to the site, or does all content have to be sent to the COVID staff email?
So we cannot upload information directly to the site, but you can contact through the email and let us know, and we'll load it on from here.
Hey, David, this is Bob Simpson. I would just add that it's a real simple process. If when folks have information that they want to add, it's just to send it to the email link with the link. And if you also want to provide a description of the information as well, we can use that description. If that's something that you want to make sure that that we're getting that right, then you should feel free to send us the description as well, and we'll use that.
Great. One person is wondering if there is going to be a distinction between the different types of local resources between state level and city level resources.
It's a good question. So right now in this version, what we've done is we've just broken it out by state. As the site grows and as we do future versions of it, we may find that we need to identify specific areas. If we had 30 or 40 resources just from San Francisco, or 30 or 40 researchers just from Chicago, we would definitely consider including an additional drop down, so that when you got to say California, there would be additional drop downs for Los Angeles and San Francisco, or you could just stay on the entire state. But for right now, we're keeping it to the state because so much of what the cities are doing is linked to state policy. But as this continues to evolve, I can imagine that we would add that.
Great. Another question is, do you anticipate that the Resource Center will be available for the next year to cover recovery resources?
I absolutely think it's going to be available for the next year. I anticipate that as the situation evolves, hopefully out of a healthcare crisis, there is no question that it segues very directly into a housing crisis, both in terms of the existing crisis we've had in terms of housing supply, which is only going to be worse because now we have the economic circumstances driving two factors. One is we're not building as much housing as we were prior to the COVID-19 crisis. That's problematic on a number of levels. We're seeing it in the LIHTC markets, which is very troubling. We're seeing it in terms of building naturally occurring affordable housing and highly subsidized housing. And we're seeing it in terms of in the homeless provision, people being moved into temporary facilities, which are not going to be homeless oriented forever. And we want to make sure that we don't have an economic crisis followed by a housing crisis, and that we really allow housing to play the traditional role that it has played in getting us out of recessions and the Great Depression, which is housing is often the leader. Housing construction is the leader moving out of that. But we also have longer term issues. When you have 20 to 30 million unemployed Americans, they are not going back to work tomorrow. They are not going to go back to work with the flip of the switch. As we open up, it'll be in stages. And in the industries within those stages, some of them will be hiring back workers very quickly. Others won't. Some companies will be going out of business and the workers will have to find new jobs. We're really looking at a much longer economic crisis, and it's going to have very directly touched housing. And then in terms of that economic job recovery, this is really back to the future for NHC. We were created in 1931, and in 1933, when FDR was inaugurated, he planned a National Industrial Recovery Act that did not have any housing in it. And we went to Eleanor Roosevelt and said, you've got to have housing infrastructure as a part of this. And they put, I think it was about $1.5 billion in today's dollars, not nearly as much as we're talking about now, but in terms of multifamily housing development for low-income families. This is existential to both our organization and how we're going to deal with this crisis longer term. Our slogan back then was housing is jobs and jobs is housing. And I think that job creation and housing are going to be very closely linked. So we're going to be very engaged with this, and I think the economic recovery is going to make this even more important. It's a long answer to a short question, but go ahead.
Oh, great. So we are getting a couple of questions just about the ability to watch the webinar after it's over. So just to clarify on that, this webinar is being recorded and we're going to post the video to our site following the conclusion of the webinar.
And it's going right here.
Yep, if you missed the first part of the webinar, you can always go back and watch it. And again, feel free to share with your colleagues or anyone in your network who you think it would be helpful for. A couple more questions, David. One about homeowners being referred to nonprofits for housing counseling and whether we have included any nonprofit organizations on the resource site.
So we have, but I'm going to let Bob or Gina address that since they've been loading content directly over the last few days.
Yeah, I would say is that we are including that information. And if you don't see your organization included, please reach out to us and we'll make sure that folks get included. We want to make sure that we're providing opportunities for folks to be able to get a hold of the counselors that they need to get a hold of. We want to make sure that obviously that the information we're providing is accurate, and so getting it directly from the source, which is the housing counselors, will be very important. So if you don't see your organization on the site, and you have a link, send us the link.
Right.
And some of you have created your own web pages on COVID-19. There have been a lot of really good resources on the web. Very early on, I know the National Low Income Housing Coalition had a lot of resources on their web page. The National Multifamily Housing Council had a lot of resources on their web page. I know National League of Cities did. There are dozens and dozens of them. Some of you are smaller and you have not invested in that or had the money for that or have been really focused on other things and have had more cursory information on there but would like to expand it. You should feel free to use our site to get your information out and organized so that it's searchable in a way that makes sense for you, and then you can link to it. Again, we want this to be as collaborative as possible.
Right. And again, that email to send any feedback or additional resources to add is COVID-19 staff@nhc.org. And to the person who submitted that question, we can also follow up with you specifically to get you some more nonprofit resources. One last.
We're really interested in building as much consumer-facing information as we can, and we're working with a major consumer-facing organization right now. Can't say whom, but they are very interested as well in making sure that we can get a lot of this information out to their members, and we want to build out that component as significantly as we can.
Right, great. So actually two more questions specific to the resources that maybe Bob or Gina could address. One is on resources for social services provision, such as meal delivery services by location. And then another is whether we've included resources on what the banks with private loans are doing for clients during the COVID-19 pandemic. And these are things that we could, reach back out to people with more specific information. But Bob or Gina, if you have anything generally that you'd like to say on those types of resources.
Yeah, I would say, Quinn, that we are, as we build this out, we're really starting with what we have, what's already available and online. And so we're gathering as much of what's existing. We don't have as much around the social services side or on the banks with loans held on portfolio. So it would be really helpful to follow up with the folks who are asking those questions to help us understand where we can get that information and what's the best way for us to put it on the website. We certainly expect, this is a work in progress. There are going to be some areas of the response where we don't have as robust of information as we would like. And we want to make sure that we get it right. So getting this feedback is going to be really helpful. So if we could follow up with those folks offline, that's what we'll do.
Great. Wonderful. Okay, so I believe that is all the questions that we have at this time. Again, if you feel like we didn't answer your question, or if you have additional questions, please don't hesitate to reach out either to me at qmulholland@nhc.org or to our staff email, which is, again, COVID-19 staff@nhc.org. David, do you have any closing thoughts?
Yes, one last thing is that we are going to be adding in the next version a site called the Oxygen Mask Rule, which, as you know, anybody who's ever flown in an airplane they tell you that if you're traveling with a small child or someone acting like a child, you need to put your mask on first before you help them. That's an old Southwest Airlines line. But you need to put your mask on first. And the reason is because when the oxygen is quickly leaving the plane, you need to make sure that you're conscious so you can help the people around you. If you try to help them first, not take care of yourself, you're not going to be useful to anybody. And we are all working around the clock, 7 days a week. I mean, we very generally in the housing world, almost everybody on this call knows exactly what I'm talking about. People say, well, this is a marathon, not a sprint. I actually think of this more as an ultra triathlon, not a sprint. And we're going to have to also make sure that we're in this for the long haul. So we are going to create a page that focuses on things like meditation, resources for employees, ways to basically ensure that you're in this for the long haul along with us. And we've gotten some good feedback on that idea. And I think it's just part of how we're going to all get through this together. So thank you all for being on the call. I really appreciate more than ever all the work that you all do. You know, we often say we are our members, but it's never been more true than right now. So with that, I want to also thank Quinn and Bob and Gina and everybody on the team who've done so much hard work, Andrea and the team at Electric Pulp. And just, you know, I often say it's better to be lucky than good. And I'm really lucky to have a team like this.
Great. Well, thank you, David, and thank you, everyone, for joining us today. Again, the video will be posted shortly on our website. All right. Take care, everyone.